hemoglobinuria in sheep and goat, the causes and diagnosis. Copper poisoning, it is one of the important causes of hemoglobinuria in sheep. Sheep are more susceptible than the goat. Breed wise, also it is the susceptibility, it varies. But as compared to acute toxicity, chronic toxicity is more common in sheep and goat. So some breeds like merino sheep and all, they are more prone to copper absorption and storage problem, and this leads to the accumulation of copper in the body, in the cells, and this leads to lysis of the cells. Other breeds of goats, they are more resistant to this, and they're more prone to deficiency. As I said, copper deficiency also causes hemoglobinuria, and copper poisoning or copper toxicity, it also causes hemoglobinuria. So acute poisoning, it follows if the animal takes 20 to 100 milligram of copper per kg per day. And primary copper toxicity, it is seen in sheep when there is excessive amount of copper intake for a long period of time. Actually, this copper, when it is taken in huge quantity, all of a sudden there is acute toxicity. But if it is taken over a long period, then this copper is getting absorbed, it is getting stored in the liver, and later on it is released, leading to chronic copper poisoning in sheep. So if sheep and goat, they are taking 3.5 milligram per kg of copper daily while they are grazing on the field, usually copper sulfate is sprayed as a acaricide, especially in fasciole infested area. Copper sulfate spraying or top dressing is recommended. So if sheep are grazing on such pasture, if you have sprayed the copper sulfate and you have let loose the sheep on the same field, then before the snails they are killed, the copper is being taken by the sheep, and it leads to copper poisoning, copper toxicity. And even if the copper is incorporated in the feed, in the concentrate mixture at the rate 15 to 20 parts per million, that also causes copper toxication. And if a particular soil is deficient in molybdenum and sulfur, that will also indirectly cause copper accumulation and copper poisoning. In sheep, copper to molybdenum ratio, it greater than 101, it leads to accumulation of excess copper in the blood and in the body tissues. So decreased formation of copper molybdate or copper sulfide, this complex, it impairs the excretion of the copper in the urine and the feces. So the sign of toxicosis, they develop when water is even supplied from a copper plumbing parts. If the tap is of copper and it is rusted, and so that time also you can find copper toxicity. Now, important source of copper toxicity in case of sheep and goat is like trace minerals. And also sometimes what happens in a farm, in mixed farming practice, where we have cattle also, we have a sheep, goat also, we have horses. Few people, they have this, that they'll have even fish, aquaculture, then they will have poultry. And if you are formulating a feed for a particular species, and the same mineral mixture is being fed to sheep and goat, but for other minerals also, mineral intake is species specific. If you are giving more amount of mineral, particular mineral, to a particular species which is not required for that species, then it will definitely cause toxicosis. And then that is why the feed formulation has to be taken care of very carefully. So this disease, as I said, it remains subclinical until a huge amount of copper it is accumulated in the liver and in the bloodstream. And now this increased liver amount of copper in the liver, this will cause increased enzymes, and this will cause later on this will lead to fragility of the RBCs and rupture of the RBCs and lead to hemoglobinuria. Now serum concentration of copper, usually if it is taken in huge amount in sheep and goat, all of a sudden then there will be acute rise, and this will cause lipid peroxidation and lead to intravascular hemolysis. This hemolytic crisis, again, it will be precipitated by n number of factors. Like, suppose there is a toxicosis of copper, but it is going unnoticed. But all of a sudden, if there is any change in the weather, if there is any transportation stress, or if there is handling problem, handling stress by the owner, and oh, sorry, to the sheep by the owner while sharing and all, or suppose there is some pregnancy, lactation, and all these factors, they will lead to. And even if the sheep, they are being chased by a dog, that will cause sudden stress to the sheep. Sheep are very delicate animals, so even if these animals are being chased by dogs, and if there is copper toxicosis which is going unnoticed, or it is in subclinical stage, all of a sudden it will flare up, and the sheep, it will fall down suddenly, and there will be death. I was saying about one problem in sheep, that sheep are very delicate, and all of a sudden when the sheep, they are being chased, they will fall down, they will become stiff, and they will die. So this is the reason for death, sudden death of sheep. So sheep, if they are injected with soluble form of copper, they also develop acute sign of uh, copper toxicity, and there will be hemolysis. And sheep, the affected sheep, they are depressed. Again, all the signs of anemia because of lysis of the RBCs, there will be signs related to anemia, and there will be depression and dullness, and there will be diarrhea in the copper toxicity cases in case of sheep. And again, as I said, many animals, they will be found dead with hemolysis and icterus. You will not know, suddenly the in the morning the animal was okay, and while grazing, suppose there was some stress, or suppose there was chasing by the dogs or some wild animal in the forest area, and these animals, they will fall down, there will be hemolysis, there will be hemoglobinuria also, and there will be death. And when you go for post-mortem examination of such animals, you will find erosions and ulcers in the abomasum. This is a very peculiar. So here again, I want to make a point to remember that abomasal ulcers are also signs of thylariasis. So again, here you have to discriminate between whether it is a case of thylaria, or whether it is a case of abomasitis because of copper poisoning. So this acute disease, there will be a sudden release of the copper from the liver in large amount, and that will lead to acute toxicity. So this is a post-mortem picture of the chronic copper poisoning case in case of sheep. You can appreciate that the in the left top picture, I have actually pasted one picture about the other. So there will be increased icteric membrane, there will be, okay. So there will be a yellow, dark yellow color discoloration of the conjunctival mucous membrane, that you can appreciate very well. And in the lower picture on the same slide, so there will be, see, you can see icteric mucous membrane, then serosa will be icteric. And in the right side of the same slide, you can see the kidneys and the liver. Kidneys, they are bronze color, that is gun metal type ka color rehta hai. So that will be bronze discoloration of the liver and the kidneys. And if you open the kidney, you will find a typical brownish, bluish brownish discoloration. So on the presumptive diagnosis, on the basis of sudden death and hemolytic crisis, you can suspect that this is a case of some poisoning. And what poisoning? Again, we can take the history, that whether this animal was in stress, or when you cut open the carcass of such animal, you will find extensive liver damage with the bronze discoloration on the liver. Then you can also go for collection of the blood, and you can see the copper concentration in the blood. Then usually in the blood, if you are giving a if you are taking blood sample randomly in live animals, the increase in the copper is very transient. Copper level, blood copper level increase is very transient, so many times it goes unnoticed. So from the sample of a dead animal, or even you can go for biopsy of the liver and kidney at the antemortem examination. You can take the biopsy samples and you can go for estimation of tissue copper concentration of the liver and the kidney. That will give you a correct picture. Then evidence of blue green ingesta, that is a very important point. And increased fecal copper concentration, that is again an important finding in case of copper poisoning. So whenever we go for postmortem examination, whenever we suspect for some kind of poisoning, we definitely send the sample to toxicology lab. And while sending the sample, we can write a note that suspected for copper poisoning. By seeing the liver, by seeing the kidney, and by seeing the ingesta color, we can find out that this is a case of copper poisoning. So we can go and we can send the sample to toxicology laboratory and we can get the correct diagnosis. So in case of chronic copper poisoning, the blood and the liver copper concentration, they are definitely increased. And during the hemolytic crisis, definitely they are increased. So, what are the clinical pathological changes? Deposition of the hemoglobin in the renal parenchyma, in the tubules. As I said, that hemoglobin deposits as casts in the renal tubule, that too proximal convoluted tubule. So there will be renal impairment. So definitely you will find the increased creatinine level, increased blood urea nitrogen level. Then liver enzymes, they will also be increased. Then serum copper concentration, it will go high as 5 to 20 milligram per ml. And then liver and kidney, again the copper concentration, it exceeds 500 milligram per gram dry weight of the tissue, or and 80 to 100 milligram per gram dry weight of the kidney tissue. Then you can give a confirmative diagnosis. Then tissue discoloration is also there. More amount of methemoglobin is seen rather than icterus here. And this is because of chronic copper poisoning. Again, there will be swollen blue, black, or gunmetal colored, bluish brown, that is gunmetal colored kidney, that can be seen. And when you cut open the kidney longitudinally, the renal cortex, it may be demarcated from the, very well demarcated from the medulla, because copper is deposited in the tubules. So the glomerular portion will be spared, and there will be clear discrimination between the colors of the medulla and the and the cortex. So there will be enlarged spleen and dark brown black color parenchyma, which is again indicating hemolysis. Because of hemolysis, the byproduct of the RBCs and the hemoglobin, they are reaching the spleen. And because of that, the spleen is getting engorged, and that will lead to splenomegaly. And the liver, it will also be friable, it will be enlarged, and it will be orange or yellowish in color. Because of hemolysis, again there will be increased amount of bilirubin, and this leads to yellowish brown discoloration of the liver. Then if you check the urine, that will be port wine colored urine or dark brown colored urine, which is again suggestive of hemolysis. If you go for histopathological examination of the liver, and the kidney, then you will find necrosis, that is centrilobar necrosis. So in sheep, if the dietary copper concentration, if it is more than 25 milligram per kg, it leads to chronic toxicosis. And if again, as I said, either copper or molybdenum, if the copper is less than 8 milligram per kg, that may be harmful. If molybdenum concentration is 0.5 milligram per kg, so copper molybdenum ratio is to be taken care of. So if you come across a copper toxicosis case, so what will be the approach for treatment? First, as we know, whenever there is a toxic process or poisoning case, we have to increase the excretion of that poison which is inside the body. You give a huge amount of fluid so that the fluids are flushed off, so the tissues are flushed off. Then ammonium tetrathiomolybdate, that is available as injection, and it can be given at the rate 1.7 milligram per kg body weight. Intravenously it can be given, or it can also given subcutaneously, double the dose, so that it is absorbed slowly through the circulation and the excess copper is removed. See, this ammonium tetrathiomolybdate, it removes the copper from the intracellular space, from the lysosome and from the cytosol, and it gets bound to this. The copper gets bound to this ammonium tetrathiomolybdate. It replaces the molybdenum, and the copper gets attached to the molybdenum part. So there is exchange, and that will cause exchange of the copper to the molybdenum, and it will be excreted, so that will be eliminated. And the withdrawal period for this should be approximately 10 days. So by that time, the sheep should not be slaughtered, or the milk from the goat should not be consumed. Again, there is another chelating agent, that is D-penicillinamine. That is to be given at the dose rate of 50 milligram per kg daily for 7 days. And again, or calcium versenate. It is also available in the market, that can also be given in powder form. This helps in excretion of the copper. Then daily oral administration of ammonium molybdate, you can give 100 milligram, or sodium thiosulfate. Again, as I said, copper, molybdenum and sulfur. This copper, it exchanges itself with molybdenum or sulfur. So either you give molybdate or you give thiosulfate. So that will exchange the copper with these ions. And that sodium thiosulfate can be given at the dose rate of 1 gram, and animals, that can be given for 3 weeks, and this helps in preventing the hemolysis, and it avoids the toxicity. Dietary supplementation of zinc acetate. Zinc actually, it acts as a protectant, and it helps in tissue regeneration, so that can also be tried at the dose rate of 250 parts per million. That helps in reduction of the absorption of copper, because it acts as a coating on the mucous membrane. Vitamin C can be used as antioxidant, and that reduces the damage of the RBCs, as we have seen in corona duration, or in any disease. Vitamin C is a very good antioxidant, and it should be preferred in most of the diseases. Wherever you find some hemolysis, or you find any viral diseases, vitamin C can be used very well. And in case of sheep, it is 500 milligram per day, and can be given as injection, or it can be given orally also. To remove the toxic effect and to remove the excess amount of copper, we can flush out the body and tissues. It can be done with the help of fluid therapy. And along with that fluid therapy, you should also maintain the diuresis, because again, if you are going on giving fluids and the diuresis is a problem, or the amount of fluid which is given is not filtered properly, or the amount of fluid is not in comparison with the amount of fluid excreted, urine output, so that will cause extra fluid in the vascular compartment, and that will lead to hypotonicity, and that will again, instead of causing any benefit, it will cause a damage to the animal. So renal, it will again cause renal damage, it will cause hemolysis, it will cause RBC turgidity, and it will cause rupture of the RBCs. So maintaining the copper content of the diet at the dose rate of 7 to 11 parts per million, and then also achieving the copper to molybdenum ratio of 61. It is helpful in preventing copper toxicosis. Otherwise, the copper toxicity is at a level when the copper and molybdenum ratio is about 101. Okay. So primary, again, there are some phytogenous roots also, from where the animal is getting copper, and it may also lead to copper toxicosis. Top dressing, many times we are doing top dressing. So when there is excess amount of copper in a particular area, in a particular pasture, you can also go for top dressing of the pasture with molybdenum, that is 1 ounce or 70 grams per hectare. You can dissolve and you can go for a spray. So that will also help in reducing the absorption of copper.